Thousands of commercial PPO and HMO insurance patients in Pennsylvania are now out of network at WellSpan Health after its contract with UnitedHealthcare expired without a new deal.
Fox 43's Anaya Falcon joins us in the studio with more on what this change could mean for patients. Anaya.
Yes, I sat down with a 102-year-old York County man who says he was blindsided by this change, an inconvenience that he says is going to be costly.
I would hate to have to change doctors at 102.
Sandy Harper is a York County senior who has UnitedHealthcare insurance, but since its contract ended with WellSpan Health recently, Harper, along with about 35,000 other patients, are out of network, a reality that he says is frustrating.
I was very disappointed because they said it would no longer be in the network and it would probably cost us more, and it's already costing too much.
WellSpan temporarily extended their contract with UnitedHealthcare to accept 3 of their insurance plans until the end of the month. That doesn't help Harper. He says he didn't receive word from UnitedHealthcare about this situation.
They kind of leave you up in the air because you don't know what's going on, really.
Harper's daughter, Cindy Myers, takes her dad to doctor visits. She says this situation is scary.
We don't even know who in York will accept UnitedHealthcare. So we don't even know if he has a local option, which would force him to have to consider changing his health care plan to some other plan that is accepted.
Changing doctors would be a big obstacle, because I'd been with this doctor for 25 or 30 years. He knows me and I know him.
This is not a population that deals easily with change. So, the whole thing is just really unsettling, I think.
Myers says her dad has a history of medical conditions. A new doctor may put him through unnecessary testing, treatment, and costs.
He's on a limited income, so the impact financially could be devastating.
Harper says all he can do is hope WellSpan will sign another contract with UnitedHealthcare.
Well, it would make my life a whole lot easier if they would sign and I could stay with the same doctors.
WellSpan says there are no new negotiations at this time. WellSpan says they initiated conversations and negotiations with United 9 months ago, which they believe was ample time to address concerns from both sides. UnitedHealthcare says WellSpan's hospitals have unsustainable price hikes, and it is their top priority to reach an agreement that is affordable for Pennsylvania families and employers.
Now, Anaya, obviously this can be a really big deal for families. Like he said, he's been going to his doctor for 25 years. So you did speak to people under the plan that's no longer accepted by WellSpan, but this doesn't mean that there are every plans that are affected, right?
Yes, right. WellSpan says there is no impact to a handful of plans like the United Medicare supplement plans and Medicaid community plans for kids, or CHIP and other plans. They have only been extended for those particular plans. Anyone who uses services through WellSpan and has UnitedHealthcare coverage, they should double check to make sure that they aren't affected by this.
Okay, good to get that clarification there, Anaya. Thanks so much.